So we know that NfL is a reliable biomarker for neuro-axonal damage in both CSF and blood, but current methods for the detection of NfL are either time-consuming, they can require specialised or expensive equipment. So we found out that there's kind of a pressing need for a rapid, cost-effective and reliable method for the detection of NfL. So we decided to employ FONLISA technology, which is called fiber optic Nanogold-linked Immunosorbent assay. So in this technology, gold nanoparticles are linked to optical waveguides for the detection of molecules. So gold nanoparticles are mobilized on an unclad optical fiber, and light is shone through this fiber, and the propagation of light causes the gold nanoparticles to undergo plasma resonance. And when an analyte is bound to an antibody attached to these gold nanoparticles, light propagates less through the fiber, and the light can be detected in real time. So this allows for the real-time detection of antigen binding to an antibody. So for this, we were able to establish an assay for NfL, and we wanted to see if we could quantify it in blood, given that it is a less invasive matrix compared to CSF. We established a calibration curve at the beginning of each day when sample measurements took place. We did this in duplicate, and everything takes place within a low-cost autoflowing chip. So the calibration curve was established at the chip at the beginning of the day. We found that the calibration curve across multiple days displayed very good coefficient of variation, so very good reproducibility within 4%. So it seems like our standard curve was very reproducible. Additionally, we conducted spike recovery tests for this assay, and we showed when we spiked NfL a low and high concentration. Again, this gave really promising results. And lastly, we wanted to measure NfL in clinical samples. So we measured it in the patient 8 control plasma samples. So these were individuals who had a CSF AD biomarker negative profile, and 8 AD dementia patients. So they had a diagnosis of Alzheimer's disease dementia at the time of blood sampling. We found that our assay could significantly differentiate between these groups. It showed a higher concentration of NfL in the AD group, which is what we expected. And at the same time, it showed an AUC of 0.77, which is promising. So we also measured NfL concentrations on the Simoa platform using the Neurology 4-plex E assay to compare the concentrations obtained with our FONLISA to the Simoa. And what we found that there was a good correlation between the two platforms. So there was a Spearman row of 0.77, a highly significant p-value. So it seems like our assay is detecting similar NfL concentrations to the Simoa. And in the future, we would like to move towards improving the reproducibility of the assay and maybe improving the sensitivity a bit. And then we can hopefully take this platform to a more point-of-care setting. So the test, the light is measured within like a very portable benchtop machine. It's called the IMB D200, and it can hold 2 chips at a time. So the fact that this is really portable, it also has no like tubing for liquid waste. Everything is self-contained within an auto-flowing chip. This means that it's really applicable for like more remote or resource-limited settings. For example, it could also be used in an emergency setting where access to really specialized equipment is limited. It also has promise, for example, like a rapid lab testing service, since results can be obtained within 30 minutes.